If you are watching this video, chances are that you or someone close to you has been scheduled for a fistula surgery at Healing Hands Clinic. Hi, I'm Dr. Snehal Porwal, co-founder Healing Hands Clinic, and in this video I'm going to be guiding you on what to expect in the first 24 hours or so after your fistula procedure. Anesthesia typically takes about 2 to 3 hours to wear off. This can be sooner or later depending upon the type of anesthesia you've been given. No food or water is allowed for the first 3 hours. You can then start with a few sips of water and an hour later by the diet that you've been advised. As anesthesia wears off, you may find it a little difficult to pass urine for the first time. This does return to normal. However, if you feel that it's taking too long or if there is pain or discomfort in the lower abdomen, please inform the doctor or the nurse on duty. In such cases, we assist in the drainage of urine. Also, in the first 24 to 48 hours, you may find that the urine has a little bluish hue to it. This is because we mix methylene blue in the local anesthesia solution for more effective pain management. Unlike traditional surgery, the pain after DLPL or FILAC is typically on the lower side. Of course, this depends from patient to patient, case to case. However, we will be administering appropriate painkillers depending upon your pain score to keep you comfortable. Don't expect stools to be passed in the first 24 hours because you barely eat anything on the day of the surgery. You'll likely empty your bowels on day 2 or day 3, depending upon how you've been eating and your bowel habits. Also, you are allowed to exert minimal to moderate pressure while passing stools. Well, this is all you need to know about the first 24 hours following the procedure. We understand this period is critical, both physically as well as mentally. Fortunately, you'll be under the close vigilance of our team, and we will be doing everything to ensure that your post-op recovery is absolutely smooth.